Hi everyone, this is Dr. Jody Lulich from the Minnesota Urolith Center. Today we're going to talk about non-surgical stone removal by basket retrieval and voiding urohydropropulsion. The x-ray you see in front of you is from Frankie. Frankie is a 14-year-old male-neutered mixed-breed dog who's being evaluated for increased urinary frequency. Frankie has a history of forming calcium oxalate stones in the past, and based on this current x-ray, Frankie has recurrent disease. Now, the owners are seeing us because they want to consider or investigate non-surgical methods of stone removal. So we're going to consider basket retrieval and voiding urohydropropulsion in this dog. On his physical exam, Frankie had a cardiac murmur. We performed an echo, and it verified that Frankie has both mitral and tricuspid disease. The good news is the disease is not that severe, such that it should not interfere with us anesthetizing the patient. Frankie was put under general anesthesia, and then we began our procedure. Our first step is going to be to evaluate the urinary system and assess the stones. We insert a flexible cystoscope in the urethra, and we're going to look down the urethra, and you can see that the urethra looks pretty normal until we reach the urinary bladder. Once we reach the urinary bladder, you can see the multiple stones. First choice is to say, can we remove those without breaking them up with lithotripsy? And I think the choice is good, or we should at least try that. So what I did is I took a medium-sized stone, captured it with the stone retrieving basket, and pulled it all the way through the urethra. I wasn't having any difficulty removing this stone. In fact, we removed that stone right away. So I thought, I need to be a little bit braver. I looked at his stones again and I said, this time I'm going to take the largest stone. So I move my stone retrieving basket over the largest stone. Once I capture it, I go ahead and move it toward the urethra, and I ask the person flushing to go ahead and flush that urethra well enough so that it's dilated and this stone comes out easily. So you can see, even though it's Frankie's largest stone, we're able to get that stone right through the urethra without any problems at all. Now, knowing that we can take out this larger stone tells us that all the other smaller stones we can easily remove by voiding urohydropropulsion. But what I didn't tell you is that Frankie is actually a 40-pound dog. Yep, he weighs about 18 kilograms, so he's a little bit difficult to lift, but that really shouldn't be a problem for most people. We go ahead and lift Frankie and position his body such that the spine is vertical. I go ahead and express his urinary bladder into this fancy contraption to capture not only his stones, but also the extra fluid that we put in. And I'm going to try and empty as much out as possible. And then I'm going to show you those stones. So you can see by doing voiding urohydropropulsion, we got out quite a few stones. After that, I inserted the cystoscope back into his urinary bladder just to make sure I removed them all and no stones were captured in the urethra. I didn't see anything, so we went straight to radiography. From his survey radiograph, really, there are no abnormalities, especially no stones. You may see an air bubble in the center of the bladder, which is typical of inserting a cystoscope. And then we went ahead just to be sure, and we did a double contrast procedure. Now, the way we did this is after injecting carbon dioxide, we went ahead and injected about 3 cc's of a radio-opaque contrast agent. From this x-ray, you can see that we didn't leave any stones in. The bladder wall is nice and thin and not inflamed, and also that we didn't damage the bladder wall at all. After we removed all those stones, we submitted them for analysis to the Minnesota Urolith Center, and they were composed of 100% calcium oxalate monohydrate. Well, there are several take-home points that I'd like you to learn from our lesson today. Number one is successful basket retrieval of larger stones is an indication that you will be successful with voiding urohydropropulsion to remove the remaining smaller stones. The other thing I'd like you to know is that the same breeds at risk for calcium oxalate are the same ones at risk for mitral valve disease. So if you find heart disease in your patient, it's an indication to avoid high salt stone prevention foods. Minimizing excessive salt in those most vulnerable patients is a healthy choice in the right direction. Again, I'd like to thank you for spending your time with us here at the University of Minnesota and the Minnesota Urolith Center. You can reach us at urolithcenter.org, where there's more information on managing many other stone types besides calcium oxalate.